want to go through just Anatomy 101, and I want to do it in a very basic way. So I'm going to ask for participation, and forgive me for the basic stuff. But I'm going to put up a little board. I'm going to draw a little diagram, and I'm going to talk about health, and I'm going to talk about how the body expresses health and how it does it, and how it loses health. When we look at the way the body works, and one of the things that I hear a lot as a chiropractor is, how do you know this? What are you talking about? You're not a real doctor, and you don't know what you're talking about, kind of a thing, right? So the first thing I say is, and Dr. Failer will say the same thing, as he gets excited and smiles, is that we go to school just as long, if not longer, than medical doctors. We have the degree, and we are held to standards to take certain boards and certain things. And it actually is almost tougher because we are under so much microscope, and we have so many things that are trying to resist what we're trying to do, that we constantly have to do continuing education, and we're constantly having to keep up with our information. And not only that, as a healthcare provider and a doctor of chiropractic, some people don't know this, but we are trained, and by law, we have to recognize anything that comes into our office. And if it's a medical problem, if it's something that chiropractic or massage or any of the nutritional things can't fix, by obligation and by law, we have to be able to recognize that and direct them to the right person. And if we didn't do that, we would lose our license and not be able to practice. And sometimes people don't know that, and they think we just want to take everything and we think we can cure everything, and we're salesmen and all this stuff. But that's not the truth. And so part of this is I want to get some of that out there. When we look at the way the body works, and we look at health, the way the anatomy works is that the most important thing in our body, and the thing that is responsible for our body to function, is the brain and the spinal cord. And forgive me if I am unable to make this big enough. Not big enough?
Mm-hmm.
Okay. So the basic principles apply here. The body is responsible for functioning as we know. The thing that controls the body and makes it function is the nervous system. That nervous system is controlled by the brain. And so if we make a little thing here that says the nervous system, and we say, that's the nervous system, that one you're probably not going to see on the thing. The board's only so big. My handwriting's not great. And we look at how that all works in itself. We see that the brain connected to the nervous system, and only through the nervous system, allows the body to function properly. And what happens when the body doesn't function properly, it malfunctions. Okay? The next step after not functioning properly is we get sick, or we go through some sort of disease process, right? Upon that point, once we get sick or we have a disease process, which is only dependent upon malfunction, which is only dependent upon if the brain and the body work properly together through the nervous system, do we get symptoms? Horrible handwriting. It's weird writing on this board. But one thing I want you to see is that those symptoms are at the bottom of the list. And when you look at healthcare versus sick care, and you look at what people are focusing on and what they've been focusing on for years, and why we are where we're at right now in healthcare, is that we are working really, really hard to eliminate these symptoms. And when we go ahead and we eliminate these symptoms, unfortunately, we haven't done anything about the sickness or the disease. And we're still not functioning properly. So we can get rid of these symptoms, and then a year or so, or less than a year later, we got new symptoms. And we say, why do we have symptoms? Because we never got rid of the sickness or the malfunction. And we never looked at health. And then we got more symptoms. And then we look at the insurance, and the insurance just keeps going up. And we keep going to the doctor. And we keep spending more money. And it's just a cyclic fashion, and now we're at where we're at. That's the difference between health care and sick care. With health care, we're looking beyond the symptoms, and we're trying to find the cause of why we got those symptoms. And if you were to be able to focus on one thing, the most fundamental thing, and there's no medical doctor that can deny all of this information and the way it works, and there's no medical professional that can deny the most important system, that I say at the very least is a contributing factor, if not a main factor, in every healthcare condition out there, it's that nervous system, because it controls everything. And when you look at the one thing that happens between the brain and the body that interferes with that nervous system, that is what natural healthcare does and affects. And that crazy word and that crazy thing that's between there is called subluxation. Now, interestingly enough, there's a lot of terms for subluxation. Pinched nerve, subluxation is a chiropractic term. Acupuncturists call it another thing. Massage therapy has different ways of going about it. All of those things come back to this concept that the brain is not communicating properly with the body. No matter if we get rid of those symptoms or not, it doesn't fix the problem. As chiropractors, as a natural healthcare clinic, this is what we focus on. This is called healthcare. This has provided, over the years, more results for the money, dollar for dollar, than any healthcare profession out there. And when you look at it, we've had a lot of resistance. We've had a lot of insurance. We've had a lot of problems of people that somehow can't afford it, or insurances don't cover it. And we've gone and we've developed ways that people can pay cash fees that are affordable. And you know what's happening right now in healthcare is that we're going to the top, because we've been dealing with that for a while. And dollar for dollar, we are by far the most cost-effective way to take care of problems, because you have nothing to lose. When it comes down to it, if we can't fix it, there's no side effects. You probably didn't spend more money than one initial exam in a medical office, and you really had nothing to lose. And by law, we can't take care of you if we're not supposed to. So it just doesn't make sense. Back to the focus in the three things that affect healthcare, the brain-body function. The three things on your outline, and we call them the 3 T's. The most important thing I think I want you to get today, if you look at outside the office decisions to make and different things, is if we look at how we lose health. We've already established the difference between healthcare and sick care, but how do we lose health? We lose health from one of 3 ways. Again, the medical profession cannot deny this fact. One of 3 ways is the only way that every human health condition occurs, or a combination of those 3 ways. The first one would be traumas, physical traumas, very obvious way. We get hurt, we get in an auto accident, we fall. Less obvious is micro traumas, repetitive motions. They add up over time, unsymmetrically doing things. Those things add up. The body doesn't forget it, and the cortisone shots and painkillers and muscle relaxers don't change the structure and asymmetry that's gone on in your body. It stays there. And eventually, even though the symptoms may go away from using some of those methods, the malfunction still exists. And so when we look at one of the main things that I see always is traumas. The next thing is thoughts, and we say stress. Okay, so stress would be something that maybe you say, well, what about stress? That sounds, like you're doing voodoo energy work. I like to say that word. We're chiropractors. We have all these terms like, does he do energy work? Stress is something that every medical professional as well can also validate, that when you are under stress, your body changes, your muscle tension changes, your biochemistry changes, the hormone levels change, and sickness occurs. Stress is one of the biggest things that cause a human health condition. And the last one is toxins or nutrition. So if we were to review all 3 ways in which we lose health, we forget about sick care for a moment, and we look at health, and we look at the 3 ways in which every human health condition occurs. It's through either physical trauma, it's through either stress, or it's through some sort of toxic chemical nutritional deficiency or introduction as far as what you breathe in, as far as what you touch, as far as what you drink.